With so much growth that we've had at Lumina Care, to go from a few hundred patients to over 27,000 patients, you really need a really strong system to be able to manage all of that. ThoroughCare has been a really, really important partner in delivering that. Lumina Care is a leading telehealth company providing preventative care management services to nursing homes across the country. Lumina is currently live in 30 plus states, over 400 facilities across both the primary care side, the psychiatric side, and any specialties that might be coming into the building. So when Lumina Care started in 2024, we thought, how can we integrate technology to one, bring the most critical needs to the forefront of those providers and caregivers' minds, and two, to direct them to any holes or gaps that might be in the care to make them more effective and more efficient with their time. We knew that we needed a technology partner that was gonna be able to grow with us, and ThoroughCare fit right into that hole. So we utilize ThoroughCare across all of our care management services, from chronic care management to behavioral health integration, the collaborative care model. And beyond just building care plans within the ThoroughCare platform, we also utilize their analytics and AI tools to really make sure that we're delivering the best care possible.
ThoroughCare is how our care managers and our clinicians coordinate care for the residents we're serving. So when you think about the population that we partner to serve, these are very fragile patients. They have complex medical conditions. They often have multiple specialists taking care of them, so care can be fragmented. Fragmented care can leave gaps, and it can also be expensive. One of the main reasons why we partner with ThoroughCare is the collaboration. We currently have over 250 care managers who work in our care delivery programs, and we have over 150 clinicians. We're all working virtually, and so ThoroughCare allows us to have a single platform. It's wonderful to see the integration and see how a clinician can work with a care manager on the same patient. So they might be working on diabetes with complications, or they might be working on a patient with dementia, but through ThoroughCare's platform, they can develop that care plan together. The care plans are easy to follow. They highlight the chronic conditions. SMART goals allow our teams to track progress. We can see the interventions, the barriers, and then we can see the medications, immunizations, allergies, any current diagnostics or diagnostics we're using to track this. This can all be included into the care plans. The care managers at Lumina Care have reported increased efficiency through using ThoroughCare's AI. So they're not spending time taking notes or documenting because they know that ThoroughCare AI is going to do that. This allows the care manager to connect more directly with the patient they're speaking to help drive that care forward for better outcomes. ThoroughCare allows us to adjust those care plans according to our partners' needs and specifications. And so we've been able to grow significantly based on requirements and then working with ThoroughCare to meet those requirements.
End of 2024, a partner approached us that they were having major issues with managing the mental health and psychiatric needs of the patients in their facility. And so we wanted to roll out a new program for Lumina Care, which was our collaborative care model. And we really had a time crunch to get it rolled out. And so we got on a call with ThoroughCare end of November. And by the middle of December, we had a platform that we could use, that we could already start building care plans and start delivering those to our client partners in about a 3-week time period. Since then, we've continued to work with ThoroughCare, and we really leaned on the ThoroughCare clinical team to help us build out these templates, our workflows. ThoroughCare worked above and beyond to build out integrations for us into our internal EMRs, into our partners' EMRs, so that we could send information from the ThoroughCare platform via their APIs. Then comes the reimbursement side of things. And we needed to work with ThoroughCare on the analytics and the reports on that as well, because we had never built for these programs before. And so ThoroughCare built out the reports that were needed, the right analytical tools to make sure that we were capturing the right amount of our population that needed these services, identifying the ones who were eligible for it, and then going all the way to the billing side, making sure that we were billing the appropriate codes for each of these care plans. From that first client back in 2024, we have now rolled out our behavioral health integration and collaborative care model services to about 350 facilities on the collaborative care model side and over 400 facilities on the behavioral health integration side.
The one thing that is very clear is by using ThoroughCare, we're able to show how month over month, we're able to drive care coordination and help improve outcomes as well as cost of care delivery for these residents. We've seen tremendous improvement in hospitalization rates. We have a 2% hospitalization rate. And once we show our partners clinical value and they can see this for their residents, they often ask us to expand in our care delivery programs.
Lumina Care's overall mission is to make sure that patients in skilled nursing facilities are getting the best care and the care that they deserve. And ThoroughCare has been the perfect partner for Lumina to grow and provide that amazing care.